Men, think back to the last time you went to the bathroom. Did the flow start strong and steady, or was it hesitant, stopping, or feeling weaker than it used to be? Did you have to push just to get it started, or stand there afterward feeling like there was still something left inside? You might think that's just what happens with age, but I want you to hear me loud and clear. These aren't random changes. They are your body's quiet way of telling you that your prostate may be in trouble. And here's the most important part men don't realize. The way you urinate today can reveal problems long before they show up on a test or cause pain. Asterisk in this video. I, Dr. Mr. SOPHIA US, will walk you through the exact urinary patterns that can signal prostate issues, explain why they happen, and share simple, natural solutions you can start at home today. From everyday foods that support a healthy prostate to easy lifestyle adjustments that can reduce pressure and restore a stronger flow. You will leave with the knowledge to protect your prostate, improve your urinary flow, and feel more in control of your health. The prostate gland and age-related changes, let's start right now. The prostate is a small gland, about the size and shape of a walnut, and it's nestled right below your bladder, just in front of your rectum. While it may be small, it plays a critical role in your reproductive system, producing the fluid that nourishes and protects sperm. Many men don't realize that the urethra, the narrow tube that carries urine from the bladder to the outside, passes directly through the middle of this gland. Asterisk, think of the prostate like a ring around the urethra. When your prostate is healthy, this ring is open and relaxed. Urine flows smoothly through the center without you even thinking about it. You feel the urge, you go to the bathroom, and the bladder empties without effort. For most of your life, this process is automatic. Asterisk, but as the years go on, changes begin to happen. For many men, the prostate begins to slowly enlarge. This condition, called benign prostatic hyperplasia, or BPH, is incredibly common after the age of 50. It is not cancer. And it does not mean you have cancer, but that extra tissue growth can still cause problems. As it expands, the prostate squeezes the urethra like a clamp. The once wide, free-flowing channel now becomes narrower, leaving less space for urine to pass through. Asterisk, this narrowing forces the bladder to work harder, contracting, with more power just to push urine through the restricted opening. In the early stages, you may not even notice anything different. The body adapts silently, adjusting to the increased resistance. But the bladder is a muscle, and like any muscle that's overworked for too long, it can become tired, less flexible, and less efficient. Over time, the changes begin to show up. The stream may feel weaker. Starting to urinate may take longer, or the flow may stop before you feel completely empty. Asterisk, because these changes happen gradually, they can be easy to dismiss. You might assume they are from drinking too much coffee that day or not enough water. But the reality is, the bladder and prostate are already operating in a different way than they did years ago. The warning signs you can't ignore. One of the earliest and most telling changes is what I call the stop-start flow. You begin to urinate normally, but in the middle of the stream, the flow suddenly slows down or stops completely. A few seconds later, it starts again. You might even have to shift your position or gently push to get it going. This happens because the bladder muscle is straining to push urine through a narrower passageway than it's used to. Essentially, the bladder is working in small bursts, pushing, pausing, and pushing again. Asterisk, another red flag is when you find yourself needing to push. Bear down or strain your abdominal muscles before urine starts to flow. Under normal conditions, urination should begin naturally and without effort. But when the prostate has enlarged and is squeezing the urethra, it's like trying to open a stuck door. You have to put in extra effort just to get it to move. That moment of straining is your body's way of compensating for the obstruction. Asterisk, waking up more than once or twice during the night to urinate. A symptom known as nocturia is one of the most common and disruptive signs of prostate irritation. When the prostate is enlarged, it can press on the urethra and irritate the bladder lining. This irritation can create a constant sensation of needing to go even when there is very little urine inside. Recognizing nocturia as a warning sign and not just a simple nuisance is the first step toward protecting both your prostate and your overall health. *Post-void dribbling. When urine leaks within a minute or two of leaving the toilet is another subtle but important clue that your prostate may be affecting your bladder function. This happens when urine gets trapped in the urethra behind the narrowed section caused by the enlarged prostate. As you stand up or move, the leftover urine is released, leaving small wet spots that can be both frustrating and embarrassing. The consequences of ignoring symptoms. It's easy to dismiss these changes as just part of getting older. But that assumption can be costly. When the bladder is forced to strain against a narrowed urethra day after day, it adapts by working harder. But over time, the muscular walls of the bladder can become thickened and less flexible. This incomplete emptying creates a perfect environment for bacteria to grow, leading to urinary tract infections, UTIs. These infections can cause burning discomfort and urgency. It's also crucial to remember that while benign prostatic hyperplasia is the most common cause of these urinary changes, it is not the only one. Prostate cancer can cause many of the same symptoms in its early stages. That's why recognizing these patterns isn't about being paranoid. It's about giving yourself the best possible chance for early detection, when treatment is often simpler and more effective. When to seek help, there are certain urinary symptoms that should never be ignored. If you ever experience the complete inability to urinate, meaning you feel the urge to go, but nothing comes out. This is a medical emergency. Severe pain in the pelvic or lower abdominal area, especially if it comes on suddenly, is another red flag. Blood in the urine always needs to be investigated. If urinary symptoms are accompanied by fever, chills, or a general feeling of being unwell, it could be a sign of a urinary tract infection that's spreading, which requires urgent treatment. A sudden and notable worsening of your urinary condition, even if it is not a complete blockage, is also worthy of attention. Even if symptoms are mild. If they are consistent, it's worth booking a professional evaluation. Seeking help isn't a sign of weakness. It's a sign you are taking control of your health and protecting your future quality of life. Solutions to support prostate health. Now that you understand the patterns and why they happen, let's talk about what you can do to support your prostate and urinary health. The goal here is threefold: to ease irritation, to promote healthy blood flow to the prostate, and to help your bladder function with less strain so it stays strong for years to come. These steps are simple, but when done consistently, they can make a noticeable difference. First, stay hydrated throughout the day so your urine remains pale and diluted. Concentrated urine can irritate the bladder and urethra, especially if the prostate is already sensitive. In the evening, give your bladder a rest by avoiding large amounts of liquids in the 2 hours before bed. Next, consider your diet for common bladder irritants. Beverages like coffee, tea, and alcohol can act as diuretics or stimulants, making urgency and frequency worse. At the same time, focus on adding foods that support the health of your prostate tissue. Tomatoes, especially when cooked, are rich in lycopene, a powerful antioxidant that has been linked to better prostate health. Pumpkin seeds provide zinc, an essential mineral for male reproductive tissues. While fatty fish, like salmon, offer omega-3 fatty acids that help manage inflammation and promote healthy circulation. For better bladder emptying, try practicing double voiding. After you finish urinating, stay put for about 30 seconds and then try again. This extra pause allows any urine that may be held back behind the prostate to move forward, so you can empty more completely. Incorporate gentle pelvic genti. Floor exercises into your routine to improve bladder control. Finally, make daily movement a priority. Even light activity like walking or stretching improves blood circulation in the pelvic area, helps to reduce congestion, and supports overall bladder and prostate function. These small changes made consistently can create a much healthier environment for your prostate. When you incorporate these habits, you are giving your body the conditions it needs to operate at its best, reducing irritation, improving flow, and protecting both your bladder and your prostate for the long run. Your urinary patterns are like your body's daily report card. When they change, whether it's a weaker flow, a stop-start stream, straining, frequent night trips, or dribbling, do not ignore them. By paying attention, acting early, and making a few simple changes, you can protect your bladder, your prostate, and your quality of life. This is Dr. Mr. SOPHIA US, wishing you good health, strong confidence, and the knowledge to take care of your prostate for years to come.